Welcome to the ultrasound-guided PIV simulator program. You are about to embark on a learning adventure like nothing you have ever experienced. This program combines online learning with hands-on experience in a way that allows you to practice on a patient while doing no harm to that patient. Welcome to the future of clinical education. I know you're excited to get started, but you've got to learn to walk, literally, before you can start performing simulated ultrasound-guided PIVs. Let's step into our practice room and review a few basics about how to operate the program before you start placing ultrasound-guided PIVs. As you can see, the screen is presented from your direct line of vision. The hands you are looking at are yours. Your movement is multidimensional. If you want to see what's to the left, move the blue dot on the screen to the left using your mouse. If you want to look down, move the dot on the screen down. You get the picture. Move the dot in the direction you want to look. Secondly, if you want to move closer to an object, use your arrow keys. Or, for you lefties out there, use the W, A, S, D keys, with W being up, A moving you left, etc. For example, let's say you look to the left and see a sink and you want to wash your hands. Use the arrow key or letter keys to get you to the sink. Please note, you have to get pretty close to an object before you can use it. For example, if you walk to the soap dispenser and the word soap dispenser does not pop up on the screen, you are not close enough and will not be able to click on the soap to use it. Whatever object you are trying to use, the name must pop up on the screen before it is operable. Once the name of the object appears, you can left-click on the object to access it. Notice you are in a patient's room. Go ahead, take a minute to look around. Take a tour. Walk up to an item and see if you can make the name appear on the screen. Take a few minutes to familiarize yourself with what's in the room and how to get to it. Okay, now that you know how to get around, notice there is a list of procedures on the left side of your screen. These are the list of procedures that must be completed to advance from this level of the program. This list is not in order. Look at the list and decide what needs to happen first. Once you decide, think about the steps involved to complete that task. For example, if you decide the first thing you need to do is clean the probe, walk over to the probe. When you get close enough, the word probe appears on your screen. This lets you know you can now access the probe. Click on the probe. Oops! An error message appears on your screen. That's not the first step now, is it? We understand that clinicians perform tasks in varying order based on habits and facility policy. This program was created based on INS standards, CDC recommendations, and evidence-based practices known to decrease the risk of complications to patients. If our program says you need to prep a paper towel first before turning on the water, hint, hint, that's because the World Health Organization says to do so in their hand-washing procedures. Don't get frustrated. Just understand that some things are negotiable and others are not. The goal is to learn to perform this procedure in a way that reduces risks to the patient. Please keep that end goal in mind. The safety of the patient comes first. Oh, and one more thing. We are a pretty tidy bunch here at PICC Excellence. If you have just washed and dried your hands and are standing there with a paper towel in your hand, your next step is to walk to the garbage can and throw away the paper towel. Same thing with wipes, empty glove packets, etc. Pick up after yourself along the way. Okay, you are now ready to get started. Good luck with the simulator and enjoy the journey.